welcome back to my channel Science Mantra. Hope you guys are doing really good. Today we are going to talk about a very common disease called diabetes, and the story of this diabetes starts with a very common and well-known organ which is called pancreas. And pancreas is a flat organ which lies in the form of a sidewise lying comma just behind your stomach. And among several other functions of pancreas, we are mainly concerned about the secretion of insulin hormone, because this insulin hormone secreted by pancreas is responsible for converting all the sugar molecules that you take in into energy. So this basically maintains the level of sugar in your bloodstream. If there is high blood sugar, there is high sugar in the blood, the pancreas gets a signal to increase the level of insulin in the blood, and this insulin converts that excess glucose into energy and thus maintains a level of glucose into the bloodstream. If you have diabetes, your body is either not able to make insulin or not able to use the insulin that is made by your body. So it can be both the cases, but in both the cases you develop similar kind of symptoms. So it's very difficult to detect which type of diabetes you have until you meet your general practitioner. If this over time, if this disease is not cured or taken care of, this can develop into several other big problems in the body, such as kidney problem, heart problems, and vision problems. So today we will talk about different kinds of diabetes in detail, and the types of diabetes are type 1 diabetes, type 2 diabetes, and gestational diabetes. So type 1 diabetes is an autoimmune disease which is a hereditary problem wherein the body starts attacking itself. And in the case of type 1 diabetes, the body attacks the cells who are responsible for secretion of insulin. So the body is not able to make insulin at all, and thus the blood sugar, which is the sugar that the person takes up, is not converted into energy, and the sugar level in the bloodstream keeps rising. So this in this case, the insulin is not present at all in the body. In the patients who are type 1 diabetic have to survive on insulin, external insulin given by the doctors for the whole life, unfortunately. But type 1 diabetes is a very rare disease, so you can see only in 5 to 10% of the population that is diabetic, they will be type 1 diabetic. Since this is an autoimmune disease and is developed and is present since the birth, the symptoms can be diagnosed at very early stages in life. So this diabetes can be diagnosed in children or teens or young people. The type 2 diabetes is a diabetes wherein the body is able to prepare insulin. There is a lot of insulin, but the body is not able to use that insulin because of some missing receptors which do not receive insulin, and they do not let them function. So when the insulin is there but the body is not able to use it, the blood sugar level increases, and the person develops the symptoms of diabetes in that case. Most of the population, almost 90 to 95% of the population, is type 2 diabetic. I'm sorry, no, not the population, but the patients are 90 to 95% diabetic patients are type 2 diabetic. So this type 2 diabetes since it is a disease which you develop over time, so this is not diagnosed at very early stages, and it takes time to find out that you are type 2 diabetic. But a regular checkup of your blood sugar level can warn you in the beginning of being type 2 diabetic. So this develops over many years, and this can be seen in mostly at the old people. And the third type is the gestational diabetes, which can be seen in the pregnant women, and In this case, the woman can be at low risk because it goes away once the baby is born, but the fetus is at a higher health risk of different kind of health problems. Even after the baby is born, the mother might have lost the gestational diabetes symptoms and everything, but the baby can be at higher risk of developing type 2 diabetes later in his life. Also, he can be at risk of developing obesity in young age or when he's a teenager. So these are the three types of diabetes in detail, and so we are going to now we are going to talk about the symptoms, because these are very similar symptoms. These type 1 and type 2 diabetes show very similar symptoms. So here is a list of symptoms that can help you to find out which type of diabetes you have. So the type 1 diabetes will show the symptoms like increased thirst, frequent urination, unexplained weight loss, fatigue and weakness along with blurred visions. The type 2 diabetes has very similar symptoms like excessive thirst, frequent urination, but in addition to that you have numbness or tingling in hand and feet, fatigue, so you will feel like tired every time, you will have blurry vision, and you will have increased hunger and itchy skin. So these are some differences in the symptoms of type 1 and type 2 diabetes. And talking about the preventions that we should take to prevent your body to have these type of diabetes is to have a regular health checkup, so you know in a very early stage that if you are suffering from these type of diabetes or not. Exercise and weight management, healthy diet, maintaining average blood pressure, so this also you can have with a regular health checkup. Of course, the low alcohol consumption, and if you're smoking, then quit smoking. Increased fiber intake. So these are some common preventions that you can take in your regular routine to prevent yourself to have diabetes of any kind. Pre-diabetes is a special word which you might not have heard very commonly, but this is a sugar level which is higher than a normal sugar level in your body. So you might have a sugar level which is more than the normal range of sugar, but less than the sugar level prescribed for diabetes, and that is called pre-diabetes. So if you have pre-diabetes sugar level, you might be at risk of developing diabetes, and that warns you of taking care of all those preventions that we talked about right now. So this is some details. Hope that was helpful to you, and if you like my video and the information was helpful, please don't forget to hit the like button, and please leave your feedbacks in the comment section. See you until the next video. Bye.